Hello, people. So today I am here to drop all of my diagnoses and what makes me high risk. Okay, so I want to start this off by going ahead and getting this baby bump out the way because some of you guys are just here for that. So here we go. And then I want to talk about pretty much so far how week 19 has been going. Tomorrow I will be 20 weeks. So if it's Wednesday when I post this, I will officially be 20 weeks pregnant at the halfway mark. Yay! But okay, so week 19 has been a whirlwind. So the day I turned 19 weeks, I went and had my level 2 anatomy scan. You guys have probably already seen that. I put that out along with the gender reveal, which just reconfirmed it for me and how everything went. All in all, that was really good. That was soon followed up the very next day with me doing my regular OB appointment, where I was put back on the red team. I was yellow. They put me back on the red team, reconfirmed that I will have to go get my growth checks every 4 weeks, and just to watch out for everything. But everything looked good and normal. Heart rate was excellent for a baby bear. And then I followed that up with, immediately after that one, I went to optometry. When I went to optometry, that's where things got fun. Where they pretty much found out that I have a swollen optic nerve. My optic nerve is swollen. It could have been swollen a while ago. It could have came from even whenever I had preeclampsia, my first pregnancy, about 10 years ago. They didn't really know. Optometry was like, ophthalmology, because optometry forwarded me to ophthalmology, which is a higher level. He was a bit concerned because I was pregnant. He did dilate my eyes to see all this, and then they went and took some, my braces are killing my lip. He went and took some scans and he showed me, and it came with a little graph chart that pretty much showed that my optic nerve was definitely swollen and it was outside of the normal green area. I was going to take pictures and then I was like, maybe I shouldn't. So, we went back. He actually got on the phone and called neurology to forward me there and told me, immediately got me an appointment to go to neurology that following morning, because by the time I got out of there, everything was closing. So I had an appointment that following morning for neurology. So I go into neurology. He was a little bit more calm about it. He was like, hey, so he noticed that you had, I don't even want to butcher these names. I'll try and insert what he called it. So he told me that he noticed that I had that, and he almost asked me, and I'm like, I don't know the medical term for it. And he threw out a couple more names, and then he said, looking at everything, it did appear that way, and that I would need to go in for a MRI, which is what the ophthalmologist also said, that, and he put in for me to go to get an MRI, but I can't do contrast because I'm pregnant, which ideally they like to see contrast. He also told me that they would also, maybe a CT scan would be easier to get into, but they can't because they don't want to radiate me. So that was cool about that. So I didn't get obviously referred for a CT scan, but I am supposed to get an MRI. And once I get my MRI, I'm supposed to come back to the neurologist so that he can look at everything. And then within a month, I'm supposed to go back to the ophthalmologist unless things are going getting worse. So they're supposed to look at everything. I was put on medications in order to combat some of these things, and so more meds for me. And then they both put in notes to my OB, which when I went Friday, I stopped back by because it's all in the same hospital. Stopped back by, and put in a note for my OB to call me. She called me that same day and was pretty much saying that she saw the notes and that I would still come in my normal appointment. But she stressed that I definitely need to follow up for that MRI scheduling, and within and then as soon as I get that date, I need to schedule immediately for neurology to look at them about 48 hours later. And then I need to get back with her to let her know if I will be able to actually push, because I told her I wanted to do a VBAC, which is a vaginal delivery after you have already had a C-section. And she said I may not be able to do that because it will cause too much pressure on my head. But in order for me to be able to do that, I have to get approval from neurology. So I have to ask them. If not, then I will be definitely getting a C-section again. And she was like, that's no problem, because obviously they prefer to try and do C-sections and stuff like, they normally do C-sections for high risk patients anyway. So even if I develop preeclampsia, they're gonna induce me. I was told in the beginning when I found out I was pregnant and went to OB that they would probably induce me at 37 weeks anyway, because they like to take the babies earlier rather than later. So I was already looking at that. I was just hoping that whenever that happened, I would be able to actually go through labor and vaginally deliver baby bear. So we'll see in the coming weeks. I should be getting a call back like today or something, today or tomorrow, to schedule that. So we'll see how that goes. And I'll go more into the diagnoses later on. I just want to get through week 19. Over the weekend was fine. The baby bear is definitely kicking more. And then yesterday, which was Monday, I actually had a dental exam, which obviously I couldn't get x-rays. My dental exam is different from the place that does my orthodontics for my braces. So I was like, hey, if y'all really need those x-rays, look at the ones from a couple months ago or whenever I first got these on, because they had to do they did other x-rays and in-depth x-rays then. So they looked at that. They said everything was fine. Everything looked good with my teeth. I have a cleaning actually later on this week, on the 19th. I have a dental cleaning because I'm supposed to get my insurance pays for me to get my teeth cleaned every 3 months because I have braces. So but that'll be in week 20. So, and then today I've just been running around, but nothing too crazy as far as with baby bear. And this week I am in up spirits. I feel really good. I'm drinking more. I have noticed that I've had to pee more often. I drink a lot more water. Like if I don't have water, and it has to be ice cold again. If I don't have water near me and I go like more than 10 minutes without it, I feel like my mouth is super dry. So there's that. I did call my doctor about this whole corona epidemic that's going on, because obviously once you get pregnant, your immune system is weaker, because I was doing a whole bunch of reading. I'm not going to get into it with you guys, but from what I was reading, it was just saying that your immune system is weaker because you have other cells in your body that aren't organic to your body. Obviously the other half, which is the father's, and your immune system almost like goes down in order to prevent those cells from attacking the baby. So or that's what they think, amongst other things. So I'm a little concerned about that, especially since I'm working in an area where people are walking around all the time and you're coughing, and you don't know if they're coughing and sneezing because they have sinuses or because they're headstrong and they don't want to go, because in the military culture, it is normal for people to be sick and not go to medical. So, yeah. But that is all as far as it pertains to my 19-week and how I've been feeling. There has not really been too many downs except for these diagnoses. And I'm just really trying not to let those hinder me. So, on to exactly what was going on. So, they said that it is highly likely that I have idiopathic intracranial hypertension, which is also known as IIH, or pseudotumor something. It doesn't mean I have a tumor. It just means that my cerebral fluids are in excess in my head, and it's causing pressure, and it's putting pressure on my optic nerve, causing it to swell. And there's nowhere for it to go because it's just a bowl. Your head is just a bowl, so there's nowhere for it to go, so it just builds pressure. And the complications with that, to keep it short, is that you can lose like whenever it's untreated, you can lose like your peripheral vision, maybe even lose your sight. That's if it goes untreated, which I'm pretty sure takes a while. But I was having vision changes where I was seeing like spots. I was getting migraines. My ear, as I was telling you guys, has been ringing. I like hear pulses in my ear. I'll get like the tunnel vision. My vision at the bottom will get wavy. Spots, I see auras, all kinds of stuff that I was attributing to possibly just high blood pressure in general, because a lot of that is common, and some of my other diagnoses that I have. So that's pretty much what it is. They put me on medications to help decrease the fluid, and I also got put on a steroid that I can only take for a max of 4 days, which I just finished today. And that's supposed to help with the pain and the headaches. And actually, I've been feeling better. I haven't really been having those vision changes. But I am on half dose because I'm pregnant, so he can't put me on a full dose. So once I'm off, right now I'm on 500 milligrams. I'll be likely on 1,000 once I get off. It's probably something that's going to be like the rest of my life type thing. But things that can improve it is just the stuff that you do for hypertension, the exercising, losing about 5 to 10% of your body weight. He says some people develop it because they're pregnant and they're gaining weight. And I'm like, hey, but I haven't really been gaining weight. High blood pressure can also do it, just normal hypertension. But my blood pressure has been good so far this pregnancy, except for yesterday, whenever it actually was like 138 over 91 and then 138 over 94 like 20 minutes later. But I don't know if that was from the meds or because I was having like a headache and I was in pain yesterday. But besides that, it's been good. So they don't really know. They were also saying that you can get build up of pressure from having a sinus infection, but it does not appear to have a sinus infection. There could also be a build up or pressure in your head because of a tumor or cancer, or an aneurysm. It's a bunch of stuff, which is why they need to go in the MRI. So whenever they take the MRI or the CAT scan, they can see what's in there. If it's absolutely nothing and those symptoms are still there, then that's whenever they diagnose you with the IIH, and they said based off of everything I have going on, that's likely what it is. And apparently it's not really common. It's not too common. So something else that I have, and a lot of the symptoms are right in line with the other stuff that I experienced from my other diagnoses. So right now, what's making me high risk prior to this was the fact that I had preeclampsia in my, put this off to the side. I had preeclampsia in my prior pregnancy, which makes me at risk for this one, and all the things that list under preeclampsia, I'm pretty much hitting wickets for. I have hypothyroidism, which I take medicine for, which is my Synthroid that I had prior to pregnancy. And it also came along with my PCOS. I have the idiopathic intracranial hypertension now. So there's that. And then I had, prior to pregnancy, hypertension, just regular hypertension. So all of those things together make me high risk, and that's not even including some of the other things that I have going on. But those are the reasons why I'm considered high risk. So, but to be honest, I feel great. I love it. This pregnancy, besides all that, I don't know, I just feel really blessed. So, that is it for this week, guys. I hope you guys enjoyed it, or my explanation. If you have any other questions, then let me know. If you're experiencing some of the same things, have you been diagnosed with the same things, let me know. As far as I know, my weight gain is still about the same. But until next time, guys, deuces.